Hello, my name is Dr. Shane Martin. I work with the Total Health Nutritional Center, and I'm doing a video on applied kinesiology, which is a system of medicine that I practice. So first off, a little bit about myself. I am a licensed chiropractic doctor, and I graduated from National University of Health Science. When I was younger, I was raised overseas in the Philippine Islands, and my mother worked as um, a medical missionary in the, I guess you might say, in the jungle, and so I really witnessed a lot of human need while I was there, and really drove me to want to practice medicine. I also have two children, and some of the things I enjoy doing are rock climbing, sailing, just enjoying the outdoors. And you can read the bio if you wish. I'll just move on. So part of the objective of this video is, number one, to give patients as well as other people the tools to explain applied kinesiology or natural medicine to their friends, their colleagues, their family, because it's even at times it's hard for me to explain. But in general, I will start with the premise that it's a whole body diagnostic system. So it allows you to diagnose and treat things very, very quickly and very efficiently. So we'll talk a little bit about disease. So there's definitely a quote-unquote new way to treat disease. Actually, it's been the only way to treat disease, and it's the way that we treat disease from the very beginning. You might say the new way that we treat disease in pharmaceutical medicine is called the germ theory, where you look for germs or viruses or pathogens and you kill them. Whereas with natural medicine, what we do is we look for stress. The body is able to heal itself. The problem is when there's too much stress, whether it's chemical stress like toxins or emotional stress like anxiety or structural stress, like maybe a broken bone or some problems in muscles. When there's too much stress, that's when the body can no longer compensate, and then you get disease. So my goal is to find and to treat chemical, emotional, and structural stress so the body can simply heal itself. So we'll talk a little bit about muscle testing. So this is one of the main tools that we use to diagnose or to find problems and then to find solutions. So the body is essentially a battery, and the nervous system is essentially the circuitry of that battery. And when you expose the body to a lesion or a problem or a pathogen, then the muscles weaken because the nervous system weakens. Whereas if you expose the body to the solution, whether it be a nutrition, a nutrient, a supplement, or maybe just like the directions the bones need to go, then the muscles will actually strengthen. So the first thing that applied kinesiology helps me do as a doctor is to find out where the bones or where the joints are malpositioned. And applied kinesiology helps me to figure out which way the bones need to go. If you're in a hospital, you'd use an X-ray or an MRI. With applied kinesiology, for instance, I can figure out if there's a disc bulge sticking out of the spine, exactly where it is and which direction it needs to go. And many times, without using X-ray, using applied kinesiology, I can tell exactly which bone is out of place and exactly which direction that bone needs to go. Another absolutely fascinating aspect to applied kinesiology is it allows me or gives me a window into the systems, even the organ systems of the body. So if I have a diabetic, I can tell if the pancreas isn't doing well. And if the pancreas is not doing well, I can tell fairly quickly if it's not doing well because of nutrition, or if it's not doing well because the immune system is attacking it. We call that autoimmune disease. And also using applied kinesiology, I can look at the gallbladder, the liver, the stomach, and I can tell if how they're doing, and what the solutions are, or I can look at the lungs, the heart, the blood vessels. So it's a very dynamic diagnostic system that allows me to find problems very, very quickly. So the great physician Hippocrates once said, "Let thy food be thy medicine." So rather than using toxins or pharmaceutical drugs, I use nutrition, herbs, and I use homeopathy to treat the chemical imbalances in the body. And using applied kinesiology, I can tell exactly which nutrition is needed, even how much of that nutrient is needed. Or with homeopathy, we have hundreds of vials. I can tell very quickly which vial a patient needs. Or with herbs, I can not only tell which herbs a patient needs, but what brand is superior. So if I have two brands and they both have ashwagandha for the adrenals, I can even tell which brand the nervous system will respond well to, or the best to. So vial testing is absolutely fascinating. So if you wanted to have your hormones checked, or if you wanted to have your complete blood count, your metabolic profile checked, that costs sometimes hundreds of dollars, even with insurance. So using vial testing, which is a form of applied kinesiology, I can get a general idea of hormones. I can see if the estrogen is high or low. With the diabetic patient, I can check their insulin. I can see if it's high or if it's low. I can check for heavy metals. I can check for food allergies. I can look for infections like bacteria, parasites, viruses, fungi. And I can do all of this within minutes. And it doesn't, as a patient, it doesn't cost you anything more than the visit itself. Some of the tools with applied kinesiology that I can use for treating emotional stress like anxiety, depression, you can see below, I can check patients, I can check their chakras, and I can tell exactly which chakra is off or which essential oil will help balance that chakra. And one patient had fairly severe, had some PTSD, and we figured out which chakra was off. We gave them an appropriate essential oil, and they were much, much better. Or oftentimes, even during COVID, I had many patients who had severe anxiety, and using applied kinesiology, I could figure out exactly which homeopathic remedy was helpful for them, and even oftentimes within minutes, their anxiety was much, much less. Or you can use Bach flower remedies, or there's a technique created by a very well-known doctor of applied kinesiology called, his name is Dr. Scott Walker. He developed the emotional response therapy. And if there's an imbalance in the flow of energy in the meridians in the body, that can cause inflammation in the brain. And using applied kinesiology, you can clear up a lot of these emotional imbalances. So this isn't applied kinesiology. This is a different system called iridology, but I thought I'd just throw this in because I love using iridology. I use this with all my first patient visits. By looking at the iris, you can actually tell what's going on inside the body. It says in the Bible, the life is in the eyes, and it truly is in the eyes. So by taking pictures of a patient's iris, I can see if there's weakness in different organs in the body, in the lungs, the liver, and the kidneys, if there's toxins in the gut, if there's low hydrochloric acid in the stomach. So I can get a very good picture of the whole body internally and even externally, and then treat them accordingly. And then as the body heals, we can actually see those changes in the eye itself. So I hope you found this helpful. There's a lot of information that I could share, but I'm trying to keep this very simple and just very functional so that you can have tools to share with your friends and your family as you talk to them. And I'll tell you what, originally I was going down the route of pharmaceutical medicine, but I encountered a doctor of applied kinesiology, Dr. Herbert Keeneman, and I was absolutely amazed by his ability to diagnose and treat me that I've realized this is the road I have to go down. So this is what I've specialized in. I've been just absolutely amazed with the amazing, even miraculous results that I've been privileged with witnessing with my patients. So yeah, if you found this helpful, let me know. You can give the coupon code seminar to any of your friends and family. They'll get a $10 off their first new patient visit, or if you're a new patient, you can simply use it yourself. Well, I hope this was helpful, and I wish you the best. Take care.